Yes, I started recording, Tori.
Okay. All right. Thank you, Heather. I know Jess is not able to join us today, so no need to wait for her. However, I believe Caroline Cruz is going to join us. So if we want to maybe
let's go ahead and get started.
Let's go get okay.
It's 1:30.
Awesome.
Let's get started. Carolyn can join us.
Okay. Awesome. Well, did you guys have an opportunity to review the agenda? I apologize, it went out a little late, but hopefully you had an opportunity to review it. Attendance is pretty quick. We have a small group, so I know who's here and who's not, so we can move on from there. The next agenda item, I'm sorry,
was input from the Oregon Parent Education Collaborative, but I think we should first revisit the key questions.
Okay, awesome. Okay. Do you want to present that, or I can?
Go ahead. Okay.
All righty. Give me just a second.
Want me to? I have them. You want me to share them?
Yes, thank you.
All right, there we go.
So as you guys recall, we were negotiating some of the key questions that we wanted to utilize the talents of this work group to go forth and find the answers to. As you guys may recall, at our last meeting, we talked a little bit and did a little wordsmithing, but then decided to take it offline and bring back something for you guys to approve and or edit. And so here's what we have. Dr. Richardson, can you make it a little bit bigger? If you see that 100% at the bottom, if you click to the right, it'll make it bigger. Yeah, not all, yeah. Perfect. Can you guys see that okay?
Yep.
Awesome. So I'll give you a minute to review the questions and let me know if you have what questions arise.
The question that comes to my mind is, how are these programs being delivered? Which might come up especially under question 3.
Mm-hmm. And when you say how they are delivered, do you mean to the individual or do you mean advertised?
I mean, ultimately the individuals. Okay. I think we can be confidently say that we know that there are many families that could benefit from these programs that aren't being reached. So what's the system for getting to the families, and what's the system for, knowing, for reaching them is the first question. And I'm learning from my conversations with Marie Davis, who's the head of public health at Washington County, that there are funding streams from OHA that seem to be relevant. We need to find out more about that. But this is a complicated issue. Some counties are, and the state more generally, as I understand it, are beginning to build systems to ensure that everybody who needs services is connected to them. But we have a lot more to learn about that.
Okay. Okay. So then from what you're saying, Dr. Bigland, would you add something to 3 to be more specific?
Well, I mean, it comes up under 1. I mean, what evidence programs are there in use? And, that would be a question of, well, who's delivering these programs and how well are they reaching? I think we should make explicit, what's the system for reaching families? the sense I got in talking to Marie
What
Davis
do you
is,
mean by system? We took system out because that was a word that I think people got hung up on. So, and I'm not sure it's relevant. System, why do we care about system? What do you mean when you say system?
I mean, I would argue that the ultimate goal of this effort is to ensure that families are being reached with programs that would benefit them. And that has traditionally been fairly chaotic with they're not being reached. And as I understand it, Oregon is developing a system that one of the Connect Oregon is is A on this agenda, and in looking at that, they are apparently developing a system that would ensure that anybody who needed a service, it would come to the attention of people who could see to it that they got that service. But I don't know very much about that.
Can I ask a question?
Of course.
If this, so this is a family intervention work group, and
Right.
is it to look at what are the programs that are currently in our state that focus on preventing substance misuse, and then ultimately identify the places in our state that we think there's a crack, and it needs to be more schools need to be involved, because that's a family-centered environment. And so right now we may find that counties are participating in prevention, but it's not mandatory. Who are they reaching? And then we find those holes and try to fill them. Is that kind of what we're, okay?
Yes. However, because of the nature of family interventions that can prevent substance use, a lot of this won't come under the heading of somebody trying to address substance use. It'll come under the heading of families that, have an aggressive kid who's out of control.
Yep.
All of the common problems of early childhood that lead to successively worse outcomes for kids need to be addressed. So, I mean, that's what I think we need to get our arms around. No, I've talked to to Claudia Vargas, who is at the Ford Family Foundation and who is connected with the Oregon Parent Education Collaborative. And it is my understanding that that's system and that network of organizations has been working to try and increase the availability of evidence-based family interventions. And so I asked her to connect me with the two people who had data on that, two other members of OPEC. And I did that a week ago. When she hadn't responded, I reminded her today. She apologized and said she'd set it up. So hopefully we can arrange a meeting with that. And I think anybody on the work group who wants to participate in that meeting should do so. Reggie, thoughts about that?
That's fine.
Okay.
But can we conclude the discussion around the key questions? You had a suggestion. I'd like to either move forward with that so we can put these guiding questions to bed.
Okay.
Can you guys still see my screen?
Yes.
Okay. Because I now no longer can see it.
What evidence-based programs are in use to assist families that can prevent substance use? I suppose you could say the next other question would be, how are families being reached?
Okay. All right.
Yeah, if that's acceptable to you, then I just say let's add that.
Okay.
So Tony?
Yeah.
So the tribes have tribal-based practices that's been accepted by the state, and we have a list of those practices.
Yes.
And so should we not
Yes.
put down tribal-based practices also if you want to do a survey on what was happening with tribes?
Well, actually, I was thinking that you could probably tell us a lot about how these funding streams work, because am I correct that you're essentially in the same relationship to OHA as a county
Well, Warren Springs is, but the
in
other,
terms of funding
Yeah. Yes.
streams?
but we have so much other funding that comes in from other sources. You know,
That
we got,
involve families?
well, they're supposed to be involving families. If they're certified as prevention specialists, they're supposed to be doing the full spectrum. They're supposed to be working with families.
Well, I think it would be helpful to us if you shared, what Warm Springs is doing relevant to families.
Let me,
I
let me
mean-
just jump in here and say, before we get too far afield, the original point I think that Ms. Cruz was saying was the making sure that we included the tribal-based practices alongside evidence-based.
Yes,
So
yes.
we'll add that. We'll say evidence-based and/or tribal-based practices.
Yeah, that's,
Does that do it, Caroline?
Yes,
Thank
yes.
you.
Because the Family First Act has expanded in tribal communities, and so they're actually required to do family programs, and most of the children who are in custody is a result of substance abuse.
Mm-hmm.
so you could provide us with a description of what Warm Springs is doing relevant to families.
I can
Zach?
give you Warren Springs, but I would like all the other 8 tribes too, and NARA.
Well, and I'd like it for them counties as well. So I guess what I was going to say is that if we had yours, we'd begin to understand what it is we need to learn, and that's essentially what we need for both tribes and counties. And hopefully OPEC can help us with that too.
Yeah.
I don't know. I don't know. Yeah, go
All
ahead.
I'm saying is evidence-based / tribal-based programs.
Yes,
In the
yes,
question.
right.
Yeah, I've added it now.
Okay, thank you.
Okay.
Thank you. Are there other things? Pam, don't you run a prevention program?
Yep. So on number 3, what is needed to improve? Could it also be and/or implement programs? Because what if they don't exist?
Yeah. Okay. Great.
Prevention.
Got it. Anything else, Pam?
Let me put my,
Just, it's interesting that we're having this discussion because several of the prevention groups and organizations that I work with, we've been thinking about this and trying to almost, and I think I mentioned this in our last meeting, almost creating an org chart, looking at the state. What are the prevention programs, supports that are at the state level, and then looking at individual counties. And if counties do implement prevention, what are the sectors, or where are they targeting those programs? And it's kind of
Yes, no, those are exactly the questions we need answered. There's a document that's in your agenda, which is F, and I.
Wait, Dr. Biglin, before you go on, can we conclude again, these key questions everybody's good with? We can move on. I can stop sharing. All right, thank you. Go ahead, Dr. Biglin, sorry.
So F is a document that is, as I understand it, all the funding streams that flow from the Oregon Health Authority to counties, and I believe to tribes. And I went through that and identified some that had to do with families, and there was the people named as people to contact at OHA were Kate Wilcox, Nurit Fischler, and Amanda Lim. And it seems to me that we should verify that they would be the people to talk to at OHA relevant to family programs that the state is funding. So that's my clue. And I think if we could get clear on that, then we would have the same kind of discussion we want to have with the people from OPEC, and we might be further along in terms of understanding what programs are being funded and how they're being delivered. And
We'll
so on.
talk with the head of the family division for OHA. That person probably knows what programs they fund. So
Good.
we'll like them to share with us their secret.
Well, and I think, yeah, perhaps after a preliminary discussion with them, we might have them meet with the whole work group. So we're getting there. The other question I have is whether there are other entities at the state level that are funding family interventions that don't come from OHA, and I'm unclear about that.
Well, we know for sure that it's DHS has some. We know that the Department of Education has some. We know that the Youth Development Authority has some. We know that the Early Learning Division has some. So there are a number of state agencies that are probably involved. I would say let's start with OHA and then make sure we get our questions refined, and then go to the next one. DHS seems like a natural next one for us because both Tori and I come from there and probably have a much better understanding of it. And so,
yes, that sounds
and
like a
go
great
from there.
plan. That makes a lot of sense.
Okay.
So we're lining up the people we need to talk to, and the next step is having those conversations.
Well, hey, Pam, since you run an organization, who are the people from the state that you interface with most frequently?
Well, it's interesting. I get money from Clackamas County. It's the only money I receive. And originally, I assume it came from the marijuana money,
Mm-hmm.
but I'm not sure.
Yeah.
But you accept the money.
Well, and it's the only money I have. And so what's interesting, with Measure 110, that was a big concern. Like, whoa, prevention always is the first line item cut. It's like, are we going to get lost in this again? And the county was like, hold on, I'm not sure if we can give you money. I'm not. So there's a weirdness there.
Mm-hmm.
And
You're exactly right. Prevention money did come from marijuana. You've now been made whole, not you personally, but that fund has now been made whole because Measure 110 did divert that money to their trust. But the state has put money back into that account. So
okay.
Hopefully Clackamas County received their normal distribution.
Yeah, but what's interesting too, so they have given us money the last few years, but then Washington County, my counterparts there, they're like, we don't get that money. So there's like a weird disconnect.
Well,
It's
that's what Davis at Washington County said, is that every county seems to be different in terms of exactly how they're organized. So
it's a shell game, and it shouldn't be a shell game.
Well, and then there's the question of, not only, so what happens to the marijuana money? How are different people spending it? And I would be shocked if they're spending it as effectively as they might in terms of what gets funded. People want to do media interventions that, I don't know if that's happening in this state, but it comes up very frequently. Or we're going to educate kids about the harm of these substances, which is not a good plan. So, okay, so
you can get the legislature to pay for that.
Yeah.
So,
You-
you know, in the past, the majority of the money that went to the counties and of course Warren Springs, because we're a mental health authority and we included the tribes, the majority of the money came from the block grant. And so there has to be 20% set aside within the block grant. However, we never got more than 20%. And so there was a few times that there was some extra dollars when the state was doing really well that we got general funds. And so remember that year, I think, Tony, that we actually decided to focus on parenting classes.
Mhm.
And we did a whole gathering it was a Quality Inn at the time. It's what, Holiday Express now, the old Shummery there on Market Street. And we invited all these folks who were doing parenting programs, and then we had them display it. And then we had all our prevention coordinators and people from education and everyone come in, and they were able to select the top, I think, 3. And then we went with strengthening family for the whole state. And so whoever wanted to do strengthening family, we put money into the
Right.
program where we actually funded this to people who wanted to do it. And there was an evaluation component out of University of Washington, not the one in Seattle, the other one. There was one of the universities did our evaluation for us. But what happened in the next biennium, there was no excess dollars. And so we told
That went away.
Yeah, they had to
Yep.
either absorb it themselves because there was no money to continue it, which was a big disappointment because we were making a big, I think, headway with
Yeah.
strengthening family.
Well, it's a good program.
Well, it is. And so Don Coyas, who runs, what's the name of his organization? But he converted the strengthening family to celebrating families and using the same format, but it was greatly adapted for the tribes to use.
Mhm.
And so many of the tribes went with celebrating families, but it is strengthening families. It's still the same program, but just named differently. That was adapted. So there has been money off and on, but primarily the counties only get the block grant unless there's some extra money, sometimes beer and wine tax. But yeah, you're right. The money that's funding Measure 110 is totally marijuana. And there's no prevention
At all.
110. And even though I argued for that but they said the law is clear, the way it's written, that is primarily for substance use disorder, not mental health, and not prevention. The closest they come in terms of their understanding of prevention is low barrier treatment and
Harm reduction.
harm reduction.
Yep.
And it's like
Mhm.
harm reduction is not prevention.
No.
You're just helping people to use their drugs in a safe way. You know, give them needles, sterilized needles, and you're doing prevention. And it's like, no, you're not. So yeah, it's been a hard battle.
Yeah,
I-
I think
I'm
we
s-
can all agree on that. It's just not an effective or efficient system. But I do want to be mindful of time. We haven't gotten to our 3rd line item yet.
Well,
Tony, did you want to give us an update about the input from community partners that you received?
well, basically under 3, I've listed all of the links that Marie Bowman Davis gave me. I was just trying to understand how Washington County works. As an example, she happens to be both the head of public health in Washington County, but she's also an associate scientist at ORI, although I only met her last week. She recently joined ORI. And so she's just given me all these things that are relevant. I highlighted the ones that I thought might have some relevance to this work group. The number F, or letter F, is the list of all of the programs that are that they're funding, as I understand it. Much of this, I think some of this is relevant to the committee as a whole, but not to our work group. I think the only thing that comes out of this for our work group is to reach out to OHA and say, who's, Reggie, I assume you know who the head person is on families,
Yes,
but it's not Kate Wilcox. It's
No,
somebody at a higher level, I assume.
yes,
Okay, so we'll follow that, and then what was the Department of
DHS.
DHS? Yes, and then I'm going to talk to OPEC, and we'll see where we stand after we've talked to those 3 groups. If anybody wants to be on the conversation with OPEC, let me know, and I'll include you in the scheduling of it once I get that going.
I would like that.
Okay. So let me make a note of that. Anybody else? Okay. So then, I'm meeting with Colt Gill and 2 other people at the Department of Education tomorrow afternoon. And Reggie, I wondered if you wanted to be in that meeting.
well, thank you.
Okay. One ask is
You want, it's, yeah, I've met many times with Colt. I'm good, thank you.
not an encouraging statement, but so
I think that you you are more than capable to handle that meeting.
well, the first time I met Colt, it was in a meeting at Oregon Social Learning Center, and insulted him. And what surprised, I did. I just said something that was very dismissive of what he had said. I didn't know this guy, right? And it didn't faze him at all. And I, gotten to be friends with him, and and when he was
Only
the superintendent in Bethel, he did a very good job. I don't know if you could be effective at ODE, but anyway.
well, that's the position. Only second to a professional coach is a superintendent, and the number of times they get fired. So he's
Yeah.
used to being insulted.
So I will, I'm going to open up the conversation about the Oregon Healthy Teens Survey, because they need to be behind that. I spoke to John Seeley, who is at the University of Oregon, and he is strong, and he works with OHA around suicide prevention.
Mhm.
And he's a very good scientist and a very good person. And he strongly feels we should have the Oregon Healthy Teens Survey going. So more allies in that.
Can I say
Yeah.
one thing about that? Again, this is just my experience trying to get my district to participate, because it's like I'm ripping limbs off. This last year, they kind of picked and chose who was going to take it and who's not. And they actually said out loud, well, we think we're going to create our own. And I'm like, the hell you are.
Yeah.
To me, those are red flags. So what I wanted to be able to say to my district, or any district that doesn't participate, what's your beef with it? And if it's the questions, let's discuss that, but put a time limit on it, because my district will drag it out, so they never have to participate.
Well, one of the reasons I met with John was because he's got graduate students who want to learn more about the prevention system. This is a graduate program in prevention science. And so he's got a couple people I think who could help us on that. I had suggested a couple weeks ago to Reggie that we could have a survey of superintendents and principals about why don't you like the Oregon Healthy Teens? All the questions you might imagine asking them. So we get on top of that. And so I think John has some resources to put into that, and some graduate students who are willing to work on it. We'll see where that gets us. And John pointed out that, you could have legislation that simply says every school is required to do the Oregon Healthy Teens Survey, and that might end up being a something we pursue, but that's not a family issue, and Reggie's ready to tell me to move on to the agenda, so let's do that. Actually, that pretty much covers everything that was on the agenda.
Okay. Let's move to, Tori, you want to talk about next meeting dates?
Yes, so the Thursday that we chose, starting this Thursday, conflicts with our overarching subcommittee meeting, the prevention, and as well as some commission meetings. And so I was curious if you guys, if we could negotiate a new date. If possible, I'd like it to be the same day, time, and week, moving forward until our work group dissolves. So is there a day and time that works for you consecutively, week after week after week? Well, bi-weekly.
Monday afternoon's my best bet.
Monday afternoons work for me as well. Do they work for you, Pam?
Me too.
What about you, Caroline? Does Monday afternoon, anytime Monday afternoon work for you?
Let me find my phone
Okay.
and see.
I will also give you guys a heads up. Hopefully we'll be able to negotiate something today, but it will be tentative because Jess isn't here. And so our group is so small, I think it's important that we find a date and time that works for everybody, at least the majority of the time. I know there'll be times with people vacation and, have doctor's appointments, things of that nature. But by and large, I want the whole group together if and when possible.
Okay. So you've got Monday afternoon and you're going to ask Jessica if she can make it? Is that where we're at?
After Caroline confirms that
Oh, right.
that works for her.
Tori, I already asked you this. When is the regular subcommittee meeting?
It is the first Thursday of every month.
Oh, yep,
So
yep,
it's November 4th, if I'm not mistaken.
yep, got it. Yep. Thank you.
That's the prevention subcommittee.
That's the overarching convention, right?
Right.
And they meet once a month. We, as a work group, will meet every 2 weeks or bi-weekly. So.
Right. Okay.
And
So once we get a confirmation, Tori, can you make sure we get calendar holds on people's calendars?
Definitely. I'll likely send the hold out today because I've already put you guys on notice that it is tentative. So it may change if it doesn't work for Jess.
And it would presumably be a week from this coming Monday
What?
to get into this 2 week.
At the 25th. Were we looking at the 1st of November or the 25th?
Probably the 1st,
The
right?
1st? Oh, now I gotta go back to my calendar.
Wouldn't it be? Because that's 2 weeks from now.
Yeah.
Yes.
Okay.
Right.
November 1st.
Well, hopefully we will have had some discussions with the people
Yes.
we've named between now and then.
That works for you? The entire
Yes.
afternoon?
Yes.
Okay, awesome.
Okay.
So we'll pick an hour. Let Jess pick the hour for us since the afternoon works for everybody. Thank you for checking. Were there any homework assignments or anything? We've answered all the questions we needed to answer.
Well, I think Pam and I have an assignment to try and have a conversation with OPEC, and
Okay.
you guys have an assignment to identify the person at OHA. And I have an assignment to talk to Colt Gill into doing everything we want them to do.
Awesome. Well, we'll come together with our homework done. Hopefully,
If everybody cooperates.
And I actually have an appointment today at 3 to speak with a few prevention people because I want to start building that org chart.
Awesome.
Yes,
Thank
yes.
you. Thank you. Well, if there's nothing more, nothing left to discuss, I think we can give back the gift of time.
Yeah.
If
Hey.
you guys can
Thank you.
I'll go to
invest
my
it
next
elsewhere.
meeting.
Yes. All right, guys. It was good
Take
seeing
care.
your all smiling faces. Have a good day.
You as well. Bye-bye.
Bye-bye.
Bye.